So this is scapula adduction, middle trapezius and rhomboides major. So patient position is prone. Therapist one hand should palpate the scapula, right? Then patient should keep shoulder 90-degree flexion, right? Then elbow 90-degree flexion position. Shoulder 90-degree abduction, elbow 90-degree flexion. From here, you have to do like this movement. Okay? Yeah. So grade 3, full range of motion against gravity, no resistance. From here, you have to do up, take up, up. Yes. See that whether scapula is moving towards the midline or not. This is scapula adduction. So grade 4. So resistance can be given 2 places. First place is here, just above the elbow. But see that to give this particular resistance, the deltoid muscle strength should be there above 3. If deltoid is weak, then here no use. So we have to give just medial to the shoulder, right? So let me teach here only, thinking that the deltoid muscle strength is 3 and above. So here, right, one hand is here. So again you have to do the same movement, but I will give resistance minimally. Okay, take up, 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 up. Make sure that scapula is moving medially with the other hand. So grade 5, against gravity, full range of motion, maximal resistance, right? Yeah, take up, 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 up. Okay, like this. So grade 2, incomplete range, right? Incomplete. It will not be full. Only slightly they will up. That's all. Grade 1, palpation, middle trapezius. Again palpate below the T7, below T7 spine, medial, lateral to the thoracic vertebra, medial to the scapula, middle, right? This is the trapezius. But rhomboides major, difficult to palpate because it is there behind trapezius. Behind, below the trapezius. So only trapezius muscle can palpate, right? That I told you already. So that way it is scapula adduction. Now another movement, scapula, right? Abduction and upward rotation. Abduction, upward rotation, flexion. Sorry, sitting. Keep your mobile here. You also take your mobile here. Yeah. What, your home? Mobile is, you know. Mobile with you, actually my home. Another mobile I did not ask. I asked this mobile only. God will not give food for you if you tell lies. No food. Okay? If you tell lie. So let me do this side. So scapula, abduction and upward rotation. The muscle is serratus anterior. The muscle is serratus anterior. So one hand, therapist hand, palpating the scapula to check whether abduction and upward rotation is happening or not. Right? So to that, right, we have to do the shoulder movement. That is flexion 0 to 130-degree flexion should be done. Knee without elbow flexion. Okay? Right. From here to here. So that time no, scapula is going abduction and upward rotation. Serratus anterior is acting. So grade 3, full range of motion against gravity, no resistance. So therapist, one hand should palpate only the scapula. Okay. Take up. Yes, check that whether it is moving or not. Scapula is moving or not. Okay. Grade 4, again the same movement with minimal resistance. Full range of motion. Right? Resistance to be given just above the elbow. Take up, 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 up. See that whether this is moving or not. Okay. Grade 3, so grade 5, maximal resistance. Okay. Do maximal. Yes. Yes, like this. So grade 2, incomplete range. Right? The range, no, when they do 130-degree with the help of the shoulder, muscle, but the scapula will not move completely. Scapula will not move completely. There is a limited movement of the scapula, right? Which movement? Abduction and upward rotation. So grade 1, palpation, serratus anterior palpated. So you know the axillary lines here, posterior, anterior, sorry, middle and anterior axillary line, somewhere middle axillary line, right? Between the thoracic spine 4, 5, 6, that area we have to palpate here, serratus anterior muscle. Right, take up. Yes, we can palpate here. So this is the movement. So how many movements we completed? So elevation completed, right? Then adduction and downward rotation we completed. Then upward rotation and abduction. Then only adduction we completed. Finally only one movement, right? Adduction and upward rotation. Adduction and upward rotation. That is rhomboides major and minor. Adduction and upward rotation. Right? So for grade 3, 4, 5, prone position. So therapist should stand testing side. The hand should be kept like this. The hand should be kept like this. Right? So one hand, therapist hand should palpate the scapula. So we have to insect the patient. Right? So for grade 3, full range of motion against gravity, no resistance. Right? So you have to take like this. Okay? So make sure that your scapula also moving. Okay? Yes. Take up like this, up. Okay? Someone will do only wrist flexion. Don't allow only to do wrist flexion. The movement should be done scapula. Okay? Yeah, take up. Yes. There is, right? Adduction and upward rotation because of the rhomboides major and minor. Grade 3. Grade 4, resistance can be given. Resistance can be given just above the elbow here, right? Yes, minimal resistance. Grade 5, maximal resistance. Okay. Then grade 2, sitting. Sitting, therapist should stand behind. Okay. Yeah. Keep this hand here. Okay. One hand should palpate. Right. Right. Again, you have to do the same this moment. Right. Checking the whether this scapula is moving or not. Scapula, adduction and upward rotation is moving or not. We have to palpate and check the scapula. Grade 2. Grade 1. Again, rhomboides major and minor. Deep muscle inside the trapezius, so we cannot palpate. So that's all. 5 movements of the scapula. What are the movements? Elevation, number 1. Number 2, adduction and downward rotation. Number 3, only adduction. Number 4, abduction and upward rotation. Number 5, adduction and upward rotation.